everyone's having a great summer. I wanted to bring on a colleague of ours, Dr. Newly Kim, who's a functional physical therapist, to talk about the concept of functional physical therapy, because so many of the athletes and active individuals that we work with at Health by Ratio have gone through some type of injury and have gone through at least one, if not multiple rounds of physical therapy. We all understand what standard PT is, and so often we have the experience where we get cleared by our PT. We feel like we've improved our health a little bit, but we still feel like we're at a far cry away from the level of athleticism or functional health that we were at before we actually got hurt. And we don't know what the next steps are to get us back to our full functional strength and mobility and stability. So I wanted to bring on, like I said, Dr. Newly Kim today to do a quick interview on what functional physical therapy is, because he is a functional physical therapist. Welcome to our little interview here, Dr. Kim. How you doing today?
Good. Thanks for having me. I appreciate it.
Yeah, absolutely. So, like I said, Dr. Newly has been a colleague of mine and works with the Health by Ratio program. And so I wanted to ask you a couple of questions and kind of let you take the floor with what is functional physical therapy to you in comparison to what we all understand standard physical therapy is?
What physical therapy has been in the past, and not to knock physical therapy in the past, but I think what we know it to be is you go into a personal or a physical therapy office or a clinic and you see a physical therapist. And a lot of times your rehab is based on protocols. And what I mean by that is if you go in with shoulder pain, there's a protocol or a system of exercises and manual work and treatment techniques and modalities that you go through that's for everybody. So if you have shoulder pain, you go down the shoulder pain continuum. Or if you have low back pain, you go down the low back pain continuum. Whereas now, the programs that people or physical therapists are coming out with they're coming out with doctorate degrees. And there's a bunch of research that's now changing the game a little bit. It's changing the game in terms of, are we now going on strictly a protocol or a typical physical therapy program that we used to go down? Or now is it, how do we now begin to address the individual and to consider how the individual is presenting in terms of their shoulder pain? Because a person that's throwing in the 90s with high velocity, with high speed and good mechanics, having shoulder pain isn't going to be the same as another individual that's throwing in the 90s and has good velocity and has good speed and good mechanics. They're two different individuals, so you can't treat them the same. And so the functional aspect comes in is, how do I treat this particular person that may present the same way, but may not be the exact same person as this person who comes in presenting the same way, but may not be the same as this person. And so I think the functional aspect is more individualistic.
Sure.
And it's based on exactly what the person needs, and not so much based on a general protocol that's for the entire population.
Yeah, absolutely. I would also and correct me if I'm wrong here, but I would also say like a couple of probably some nuances, or at least an elaboration of what it is that like individuals like yourself specialize in making that program unique to each athlete or each individual. It's not about just addressing the pain site. It's about addressing the whole body. And that's where really the nuances come into play, right? Because like you're saying like one baseball player that has shoulder pain, they could have that pain for the reason of something that's going on in the elbow and in the shoulder, versus another person could be having that pain because of something that's going on in the hips and the thoracic spine, right?
Absolutely. And I think that poses two thoughts. I think number one is whenever you receive physical therapy, you should be, the physical therapist should be able to provide you with at least two things. At the very minimum, these two things, be able to answer these two things. And number one is what? Right? Hey, I'm having shoulder pain. I came in to see you. What's happening? What is going on? What is the actual source and pain site that is actually being the nuisance that's causing my pain?
Sure.
Number two is why.
Right.
Why is the what happening? Why? So if it is this particular thing, if it is a joint, if it is a muscle, if it is a ligament, why is it that whenever I pitch, this thing is getting irritated and causing me pain?
Right. Why is
So
that the
that's
biggest link?
exactly. And so for in my time, for me, I want to number one figure out what is going on, and then I want to figure out the more important question I believe is why. Why is that particular tissue or that particular anatomical structure causing you pain? Is it the shoulder? Is it the neck? Is it the back? Is it the upper back? Is it the thoracic spine? Is it the hip? And so I think that's where it ties in with a little bit more of the functional side too, where you just because you have shoulder pain, addressing the shoulder may not get you cleared for return to baseball or football or
Sure.
running or hiking. It doesn't mean that, oh, I don't have pain and so I can return to these things, but rather it's like, how do we now get you to a place where we're addressing other impairments or other issues that are feeding into that pain, that, hey, now Madison can return, or now Newly can return, or Stacy can return to whatever she enjoys doing fully and confidently.
Yeah. Well put. Very well put.
So,
Cool. Very cool. Well, then I want to go on to our second question, which is, why do you feel like this kind of thought process of physical therapy, where we're kind of looking at the whole system, we're looking at it more as a customized, individual by individual type of programming, is more effective than kind of that our old school general PT that kind of goes along the lines of certain protocols for certain pain sites that we experience? Why do you feel like this is more effective in getting your patients the results that you're looking for?
yeah, and I think I touched on this a little bit earlier in the question, but because you and I aren't the same, and I am not the same as anybody else in this world, physically, emotionally, spiritually, in mind. And so if you and I were to walk into the clinic and both express that we have knee pain, and we both have knee pain when we go upstairs, or when we sit, or when we walk, and it clicks, and our story is the same, it does not mean that individually that you and I should be treated the same.
Sure. I like that you're saying that.
Yeah. On a care level, on a personality level, but just even anatomically, structurally, you and I aren't the same. And so for me to say, for you to come in for you to go in and for me to go in alongside with you, and for us to get the exact same protocol and the exact same progression of pain, or the exact same progression of physical therapy care, would be a disservice to you and would be a disservice to me.
Sure.
And in addition to that, that's not physical therapy. Protocol-based driven rehab is not physical therapy. I feel like, and I want to be sensitive here.
Yeah, no, please.
I feel like anybody can do that. I feel like if there's a folder in a cabinet with a bunch of papers that say, hey, knee protocol, go ahead and give that to Madison, and go ahead and give that to Newly, and walk through this with them. Anybody can do it. Anybody can do it. And so, yeah.
That's why YouTube videos have become so popular. Like, you can essentially figure out general physical therapy protocols just by YouTubing stuff now. Like, if you want the standard ACL knee exercises to be able to do 10, 12-inch step-ups, you're have at it. Like, that's fine. But if you want to learn how to be able to broad jump and change directions and cut again, that's a totally different ball game. So feel free to YouTube that simple stuff. But when you want to get functional and performing again, that's a whole different ball game. Yeah, that's a great point.
Yeah, and what's to say that YouTube's going to clear you for return to sport and say, hey, YouTube said I can actually go in and cut and shoot and jump and slam dunk and throw a baseball. Like, yeah, that's scary to me. That's and not just YouTube, but Google too. You know, a lot of patients come in and clients come in and they express, you know, this is what Google told me I had. It said I had knee pain and all the way to cancer. And I don't know what to make of it. My symptoms fit both categories, and so Yeah, all that to say, yeah.
Yeah,
I'll,
I agree. I'm on the same page with you. That like I can't tell you with how many like on the different groups that we're involved in on Facebook and the different blogs that we follow and stuff like that, how often our clients and patients, they come to us and they're like, oh, I follow these exercise protocols I read on XYZ blog. And I'm like, that's great. Not saying that that blog was wrong and those
yeah,
exercises were terrible, but
absolutely.
how do you know that was what you needed? Like you're isolating in on one particular pain site and you're not paying attention to the rest of the body that's impacting it. If I had a nickel for every time that happened, I would have hundreds of dollars. I wouldn't necessarily be a millionaire, but I'd have hundreds of dollars.
Yeah.
So then my last question for you, Dr. Kim, is what I think this is a question that so many of our clients that come into Health by Ratio, they're curious about it. And so I figured I'd ask you so you could talk about it here is how do you treat your patients when they're not in your office? So like, I think people, because we're so used to a certain type of therapy where there's a lot of manual work being done and a lot of hands-on techniques with the therapists themselves, the idea of having it be an online format is a little bit foreign to people. My question posed to you then is like, how do you go through working with somebody in an online basis?
Yeah, and I just want to acknowledge that statement there, in that it is a world and a space where it has not been considered or even tapped into by the majority of the people, not only in the medical community, not only in the physical therapy community, but also in the medical community as a whole.
Sure.
And I was just talking to a colleague about this, and he was even expressing how we were agreeing how slow we are as a medical community to consider technology and telehealth rehab and medicine, telehealth medicine and online medicine to provide quality care. And just want to acknowledge that, and then also to say that change is difficult. Change as a whole is difficult, especially when the conventional medical medicine approach has been to walk in, to drive 15, 20 minutes, an hour to see you and to sit in the office space for an hour and to see your provider for 5 minutes, and then to be given a prescription and then to be sent home, and to change that and to move into a new realm of care is different, and it's difficult because it's changed. It's unconventional. All that to say, as a physical therapist and as a physical therapy community, we pride ourselves as anatomists, as being experts in human anatomy, and that's not just static anatomy, meaning I can take a look at a skeletal structure or a musculoskeletal system or a nervous system and identify what the structures are, but I can see how joints and ligaments and muscles and bones all intertwine and interplay with one another in human movement. I am an expert in human movement, and our community physical therapists are experts in human movement. And so with that said, we are trained and we have doctorate degrees and the ability to visually see and take a look even remotely, and to see human movement and see the motions of particular joints in relation to other joints and other body parts, and then to say, hey, that's normal movement, or hey, I see the dysfunction there, or I see the issue there, and then to be able to dissect it in a way where we don't necessarily need to get hands-on, where we need to touch and push and manipulate with our hands, but rather we can identify it via our eyes and to see, hey, there's the issue that's going on, and here's why that's happening. And so we're able to both address visually through movement, both the what and then the why. And that's what we're experts in, and that's what we're trained in. Now, all that to say, there is a time and place for where the patient or the client may need some hands-on work, may need a one-on-one in-person care approach. And I'm not saying that this is the only world and this is the only thing that we're moving into, but rather, hey, you may need to go see your physician. You may need to go see an orthopedic specialist. You may need to go see your neurologist. And this type of meeting, this type of telehealth communication bodes for that as well, where we're able to refer out, triage people into the right spaces and say, hey, Madison, we don't need this at this particular time. You need to go see such and such physical therapist down the street at your home, and to convey and communicate to them, hey, this is what's going on. And then eventually come to a place where, all right, I've done the hands-on work, or I've done the in-person stuff. Now this is a time and place where this is appropriate.
Got it. So I would like maybe another way of like saying it, and correct me again if I'm wrong, would be essentially what you are able to do is if you're able to visually see someone. So like if you're connected through a video chat, like we are on this Zoom conference call, you are able to study the way someone moves from a distance, see where the deviations are from head to toe, and then determine the whys of what that's happening, and then create the program that will help correct those whys if it's appropriate for them. Sometimes there's states like if you, using the ACL as an example, like if you just tore your ACL, just got it surgically repaired, you probably need some manual work. You probably need some range of motion improvements with it in a very isolated, monitored way with somebody that's guiding you and potentially hands-on manipulating you through that. But if you're at a stage where you're building back up to your natural movement patterns and learning how to squat and walk upstairs again, even running, cutting, changing direction, jumping, that kind of stuff, you're able to look at what's going on from head to toe, see where the imbalances are, and then give them their stretching techniques or their not releasing techniques or the exercises that are going to improve wherever the causes are, and be able to move them into that functional, the functional direction that they want to, getting back to the level of athleticism or just general fitness activity that they want. Is that correct?
Absolutely. And yeah, you couldn't have said it better. I think yeah, they're coming. This is not the end all be all, but this is another resource and an avenue where people can access to receive quality care. And so if it is that you do need hands-on work and you do need more one-on-one care, in-person care, by all means, we're all for that. But this is a time and place where this is a resource, and especially as times are changing and online technology is growing, I strongly feel, and I think the physical therapy community also feels strongly that quality care is not compromised through remote or telemedicine, but rather it just serves as another high quality care resource for clients and patients.
Absolutely. Well put. Yeah. This is a resource that allows, like you said, people to save all that stinking time with having to drive and sit in an appointment office. And then sometimes with certain practices, physical therapists get so overbooked. They're working with so many people at the same time that you end up spending all this time and energy to get really 5 or 10 minutes of one-on-one help. And then you're sitting on stim and ice for a period of time kind of thing afterwards. And as opposed to doing all that, this is something where physical therapists like yourself are able to work with clients in a one-on-one format, but in a very time efficient manner but still giving the person the specific attention that they need that's actually practical to their movement pattern. So I really appreciate it. Like, you're a pleasure to work with, and I really appreciate you taking the time to kind of explain this to everybody, because these are so many questions that I often get. So I love that you were able to more thoroughly explain what it is that you do, and the up and coming PTs like yourself that are are really trying to hone in on holistic movement pattern biomechanics and correcting the whole body's function. It's something that's invaluable. So on behalf of myself and Stella here, we thank you for taking the time to do this interview.
Thanks for having me.